Dragon presents Chinese medicine in America. My name is Joel Penner. I'm a doctor of Oriental medicine, an acupuncturist, and herbalist. I'm also co-author of the textbook Zang Fu Syndromes, Differential Diagnosis and Treatment. This episode is entitled Diagnosis Introduction Part 1. We will be discussing pattern or syndrome identification. Chinese diagnosis relies on pattern identification. It's based on the understanding that signs and symptoms reflect the condition of the internal organs. It uses not only signs and symptoms, but other manifestations, many of which are not otherwise related to a disease process, to form a picture of the disease in an individual. Every symptom and sign relates to one or more disease patterns called syndromes. Signs are what we as practitioners observe, such as skin colors and textures, strength of voice, and levels of activity, like whether the patient is upbeat or depressed. It is also important to observe the tongue and pulses. While signs are what we observe, symptoms are derived by asking the patient. Asking is primarily done by using what is called the 10 questions. The 10 questions represent areas of questioning rather than specific questions. The answers to the questions then become indicators that point in specific directions. I will describe the list of subjects to inquire about, and in some cases give examples of where they point. The first area we'll look at is chills and fever. If chills and fever appear together, it points to an external invasion. If there is only fever, it points to heat, and if there is only chills, which are more frequently referred to as aversion to cold, then it points to cold. The next area is sweating. Sweating happens due to either heat or deficiency of qi, yang, or yin. We want to know, for example, what brings it on and what time of day it occurs. You will learn what other questions to ask as you learn which symptoms are associated with each of the syndromes. The next area of questioning is the head and body. Where does it hurt? The answer to this can not only tell us what areas of the body need treatment, but which organs are involved. The next area of inquiry is about the chest and abdomen. Symptoms in the chest can relate to the heart and or lungs, while symptoms in the abdomen can point to spleen, stomach, liver, or kidney involvement. The next area is about food and taste. Are there specific foods that the patient either craves or is averse to? Remember, taste, along with most other signs and symptoms, has 5-element correlations. Stools and urination are the next area. These questions obviously point to the condition of the digestion and the kidneys and bladder. Next is sleep. Insomnia points to the heart and some type of Shen disturbance. Deafness, tinnitus, and vision are the next area. Deafness and tinnitus point to the kidneys, while vision problems point to the liver. Thirst and drink is next. Thirst points to heat or dryness, while lack of thirst points to cold or dampness. Pain is our final area of questioning, although pain is usually the first thing a patient wants to tell you about. The area of pain, its intensity, and whether it is fixed or moves around are important things to know. Moving pain indicates qi stagnation, while fixed pain indicates blood stagnation. There are 2 additional questions for women, which are about menstruation and children's problems. Questions about menstruation include the length of menstruation, the amount, the color of the menses, and whether or not there is pain. Children's problems can adversely affect the mother and create worry and fear. It is important to understand that the 10 questions are only a guide. You can and should ask anything you feel will help you determine the syndrome. Once we have gathered all of our information, we need to understand what it all means. Zang Fu diagnosis is our method of determining which syndrome or syndromes our patient is experiencing. Each syndrome consists of 3 factors: organ function, pathology, and the vital substances involved. The internal organs, the Zang Fu, have specific signs and symptoms associated with them. The vital substances, including yin, yang, qi, blood, body fluids, and jing, also have specific signs and symptoms associated with them, as do pathogenic factors. We use the 8 principles to begin organizing our information. The 8 principles give us a look at the pathology involved in the syndromes. They include whether a pathogenic factor is external or internal, hot or cold, is an excess condition or a deficiency condition, and whether it is yin or yang in nature. The first 3 pairs, external or internal, hot or cold, and excess or deficiency, are diagnostically significant and help us determine the pathology. Whether a condition is yin or yang in nature is not diagnostically significant and is not generally included in our differentiation. Yin and yang are included as vital substances, are significant in that context, and will be discussed later. The first thing we need to know is whether a disease is an external wind invasion or an internal condition generated by toxic thinking and emotion. External pathogenic factors are always introduced into the body by wind. All external pathogenic factors are excess and generate excess conditions. The primary external factors examined by Zang Fu diagnosis are wind cold, wind heat, and wind dryness. Wind dampness, which is also a wind invasion, is studied within the context of a condition called painful obstruction, or B syndrome, which can be understood from a Western perspective as arthritic conditions. I will not be discussing painful obstruction in this series. You can go to AmericanDragon.com and click on painful obstruction under the Conditions tab in Treatment Protocols and get an idea of the numerous possible permutations and combinations that exist in wind, cold, damp, or arthritic conditions. From a Zang Fu perspective, external invasion is discussed in relationship to the lungs, which are the Zang organ affected. There is also a very sophisticated method of external diagnosis called Shanghan Lun Wenbing. Shanghan Lun examines the progression of an external wind-cold invasion through the channels from superficial to deep, while Wenbing examines the progression of an external wind-heat invasion moving from superficial to deep through the energetic levels of the body. These levels include the defensive level, the Wei level, the Qi level, the nutritive level, also called the Yin level, and the blood level, also called the Shui level. Both Shanghan Lun and Wenbing are based on Chinese herbal medicine and require a sophisticated understanding of Chinese herbs, channel function, and Chinese medical theory, and will also not be discussed in this series. Let's take a look at the signs and symptoms of an external wind invasion. Wind invades through the pores of the skin, primarily at the back of the neck. It also invades through the nose and the mouth. First, fever and chills occur simultaneously. Chills are also referred to as aversion to cold. In my experience, fever is not always obvious, but aversion to cold is. Simultaneous fever and chills describes the battle going on between the pathogen and the defensive qi, or Wei qi, which is attempting to prevent it from entering the body. Next, we see neck and shoulder pain and body aches. These occur primarily when the pathogenic wind enters through the pores of the skin and lodges in the channels, preventing the smooth flow of qi in the upper body. All forms of stagnation present as some type of pain. If the wind enters through the nose and/or mouth, you may see lung symptoms, such as sneezing or coughing, and may not see the neck and body aches so predominantly. Finally, you will see a floating pulse. A floating pulse is one that, under light pressure from the fingertips, rises up to meet them. It indicates that the activity of the body is focused at the superficial level. In reality, aversion to cold and a floating pulse are the minimum signs and symptoms needed to make a diagnosis of an external wind invasion. If a condition does not include a floating pulse and aversion to cold with or without a fever, it is considered to be an internal condition. We then need to determine if a condition is excess or deficient. All external invasions are excess conditions since pathogenic qi is entering from the outside of the body. Excess conditions exhibit all or some of the following general signs and symptoms: rapid onset, a strong, loud voice, severe pain made worse with pressure, a very red face, profuse sweating, and outbursts of temper. Deficiency conditions present as signs and symptoms of internally generated imbalances brought on by toxic thinking and emotions. They include chronic diseases with gradual onset, a weak voice, weak breathing, listlessness, dull, lingering pain which is relieved by pressure, a very pale face, slight sweating, a quiet disposition, apathy, a poor memory, and a deficient pulse. Let's now take a look at the signs and symptoms related to heat and cold. Heat moves upwards and outward. It is stimulating. Its color is red and it is drying. Its signs and symptoms are fever, thirst, a red face, red eyes, constipation, dark, scanty urine, a red tongue with a yellow coat, and a rapid, full pulse. It is not necessary to see all the signs and symptoms of any of the diagnostic principles to make a diagnosis. For example, external heat almost always shows a fever, but internal heat may not show a fever at all. Cold moves downward. It is contracting. It generates fluids. Its color is generally pale or white, or sometimes bluish. Its signs and symptoms are chilliness, cold limbs, lack of thirst, a pale face, cold abdominal pain, a desire to drink warm liquids, loose stools, clear, abundant urination, anything that is whitish or pale, and anything that is concave as opposed to convex. As an example, heat lesions on the skin are generally red, with perhaps yellow exudate, and they are convex, they push upward and outward, while cold lesions are generally pale, concave, and may excrete white or clear exudate. Other signs and symptoms of cold are bluish lips, fingers, or toes, and bluish purple or a pale tongue, with a white coat and a deep, full, tight pulse. Well, that's going to do it for this episode, Diagnosis Introduction Part 1. In our next episode, Diagnosis Introduction Part 2, we will look at the signs and symptoms associated with the vital substances and the pathogenic factors. If you have any questions, please contact me at joel@americandragon.com. I'll see you then.